If you're creating a service for us, who knows better than us about what we want, how we want it, what makes it accessible for us. Like, it's the lived experience perspective that's so important when making and developing services for young people, because they're the ones experiencing the issues.
So the Youth Council was established in 2017 and it's a group of young people aged between 16 and 25. At the moment we've got about 25 participants, and essentially they're the voice of young people throughout Western Sydney Local Health District. So they provide their insights as consumers. Those insights, I guess, feed back to help guide and shape our health services and systems. We know that young people make up 20% of our population in Western Sydney, and so it was really just born out of they're the users. We need to make sure that we're asking for consumer feedback. We want to make sure it's a safe space, and it can be quite intimidating for young people to go into this meeting with 20 high-level executive members of our district, and so making sure that they've got a space where they can discuss that and then it gets reported through me.
Every month we have a meeting at Westmead Hospital and it goes for 2 hours in the evening.
I love the social aspect of being in the Youth Council. The pizza each week makes it amazing. And I also love the service element of it, the fact that I can give back to my community. Sarah will present opportunities to us where other services or the health district has reached out to the Youth Council for feedback.
We might be doing lots of brainstorming around health promotion. So we have an Instagram account for Western Sydney Youth. So it could involve creation of videos and reels for health promotion messaging that the young people have identified and find there's a gap.
They also run their own projects, so any kind of issues or initiatives that they want to run in the community that they think is important for young people, they will start these projects from the ground up. So things that we've done in the past is art competitions, youth week events. We ran a really big youth forum last year, which was really successful.
A lot of the projects that we work on is all guided by young people, what they think is important, and they drive a lot of the organisation of that.
Last year, the biggest thing we probably did was run a youth forum, where essentially we got hundreds of people from all different schools, all youth, all school age, to come in, and we gave them a day focusing on mental health. During that day, we had lots of different activities where they could explore how to foster positive mental health. So one of those things was a poetry session, and there was another place where they could express themselves through art.
We spent a lot of time thinking about what we wanted to do there, what we wanted to speak about, who we wanted at the forum, and we finally ended up with a group of panellists who answered questions that young people wanted answered. And we had an expo where a lot of different services gathered with the outcome of trying to make referrals and accessing the services easier for young people.
It can be challenging trying to organise 25 young people, because young people they might have this, but in their priority list they've probably got school, the HSC, they might have university, they might have their own health concerns, and then not even accounting for a social life or any other issues that might be going on for them. So it can be difficult because it might be top of my priority list, but for young people it might fall a little bit further down depending on what's going on. So I think really trying to develop that rapport and having those conversations with young people and meeting them where they're at is really important. Over the course of the year, I do try to make sure I have one-on-one conversations with everybody and do make it a safe space where if they've got stuff going on, at least I'm aware of it and can kind of fit in where they need to, or provide them with that extra support.
I always feel like we're taken very seriously, and we're always given heaps of opportunities to give feedback. We're never forced to, and we're never made to feel uncomfortable, but we're given so many opportunities, and Sarah's always very accommodating to us.
I think it is critical to listen to young people when talking about health policies, health programs, services, because at the end of the day, if you are creating a service that is meant for young people, you need to listen to young people to know how to create that service. You need to know what they're looking for in a service, what makes them feel safe, what makes them say, yeah, I want to go here rather than a different place. And you just don't get that sort of knowledge or information unless you're actually listening to young people.